Hi, I'm Dr. Jeffrey Annamarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to our Facebook Live. Today I want to spend some time talking about our Physiq device. This is a non-surgical way of targeting small areas of unwanted resistant fat that you can't control with diet and exercise. Again, this is non-surgical. It combines heat and also muscle stimulation. So it's the only one on the market that can combine both of them. And then we feel that that's important with really targeting those areas. So this is, again, an in-office treatment. There's no downtime from it. Basically, the most common areas are arms, hips, abdomen, thighs, and we've also seen some reduction in the appearance of cellulite. So this is a device that when you come in, there are 4 paddles, so it's kind of nice so you can treat multiple areas at the same time. These paddles we just put a little bit of gel on there, on the area, put this over the area you want to treat. We use these Velcro straps to hold the paddles in place so there's no pain, no discomfort. We set the device for the patient's comfort level. So the first part of the treatment is heat, and those areas can get pretty warm. And then after that, we have a muscle stimulation component of it. Those components can also be blended together, but I feel that targeting the heat first and then followed by the muscle stimulation actually gives you the best results. The standard treatment time is about 30 minutes for the heat and about 20 to 25 minutes for the muscle stimulation. So your overall treatment time is about an hour. There's no downtime, so when you come in, we do this treatment. You can basically, after that, go and do the rest of your day's plans, go back to work, go exercise. You can exercise immediately afterwards. The key thing is that you have to massage the areas, because as this targets the fat and we break down the fat cells, we want to massage those areas and kind of get that tissue to be reabsorbed and excreted. So we recommend vigorous massage for 3 times a day until the next treatment. Technically, the treatments are every week or every other week. We find the best results. We started with every month, and we found that as we shortened the time interval between the treatments, the results were better and better. So again, this is not a weight loss program. So it's basically for patients that have good control of their body contour with diet and exercise. These will target some of those resistant, tough to treat areas or tough to control areas with non-surgical means. Also, it usually takes 5 to 6 treatments. Most of the time, patients are not really seeing a big result until at least the 3rd treatment. So it does take time. It's not like liposuction where you see a result much sooner, but it will take time. But again, coming in whenever that hour that you can give us and go back to the rest of your day.
And you said you can treat more than one area at a time?
Right, so depending upon, some patients come in, they want their hips and their lower abdomen done, so we have a paddle on the hips, paddle on the lower abdomen, put that strap around. You can treat all of those areas all at once. Sometimes patients want to come in and do the inside of their legs, the outside of their legs, so you can put a paddle on each area. You can treat arms and legs, you can treat arms and belly. So, and if there's more areas, then we'll just have to do a combined treatment. So you would do the 4 paddles on one area, and then after that's done, after that first hour, put the paddle somewhere else and treat again. So all those areas can be treated in one setting. It's just going to take maybe an hour and a half to 2 hours instead of an hour.
So you mentioned this is not a weight loss.
Right, so it's just to think of it just as any type of liposculpture. As I've said before, liposuction is not a weight loss program. Neither is Physiq. It really just targets some unwanted fat pockets to reduce those pockets. It just takes time, but patients will say, how much weight am I going to lose? It's really a matter of how many inches can I lose? How much can I contour better so I fit better in my clothing?
How long will the results last?
The results should last indefinitely as long as you're maintaining your weight. As we get older and our weight shifts a little bit, you might have to come back in and treat other areas. and know that fat doesn't come back in other areas. I think that's one of the big misconceptions about liposuction. We've touched on in other Facebook Lives. If you're treating those targeted areas that you're hard to control, and we reduce that amount of fat, those fat cells are gone completely. Your body's not going to compensate and have you grow more fat somewhere else. So just to kind of dispel that myth for this as well.
Can a person continue to exercise after this procedure?
Immediately afterwards, you can do this procedure and go work out afterwards. Actually, we encourage you to keep exercising because, again, that muscle movement will help move that the breakdown of those fat cells even better. You still have to massage vigorously. The nice thing about the muscle stimulation is that you do get some growth of the muscle because you're stimulating it, and that stimulation also helps move that broken down fat cells back into the lymphatics where you can excrete it.
And can you tell me again how the process, you put the paddles on, what am I doing while I'm sitting there?
Well, the nice thing about that is, again, it doesn't hurt. These paddles are sitting exactly where you want them to sit. We can, again, there's 4 of them. We can put them here and here, put a strap on, and then the downtime for you is to bring in your phone, bring in a book, you can watch a movie, you can just sit here, you're just sitting in one of our chairs and be treated. So it's really not, it's about an hour of downtime for you. So you can answer emails, text, go on social media, whatever you want.
And how many treatments did you say you would need?
Generally speaking, 5 to 6 treatments.
Is there anything a patient should abstain from when they're doing this treatment?
No, there really isn't. I would just say, continue with your normal diet and exercise programs. But there's really nothing. The nice thing about it, you're not undergoing anesthesia, you're not undergoing any surgeries. So it can treat a lot of different patients, even with some wider range of medical history.
So if a patient is interested in hearing more about this device, what is the process? Do they set up a consultation with you?
Yeah, so you would basically set up a consultation. You can either start it with a virtual consultation with me online. I would still need you to come in so that I can examine you. You can call our office, 844-496-6647, and set up an appointment that way. I really like to sit face-to-face with the patient. I need to look at those areas, see what your skin tone is, what the tissue tone is, because sometimes it's not a good candidate. You're not a good candidate for this device, and sometimes one of our other devices, like our Lipo AI device, which we do in-office liposuction, versus going to the surgery center and having more extensive liposuction. So we can be able to fit you into that depending upon what's going to be best for you. The nice thing about this is again something that for smaller areas, good tissue tone, we can kind of decrease those areas without having surgery, but we have the other 2 modalities if this one may not fit what you need or what your goals are.
And that is something you discuss in the consultation?
Correct.
And you mentioned Lipo AI. What exactly is that device?
So Lipo AI is our newest device. It's excellent. It combines the laser lipo technology into a smaller device. That laser lipo came out about 12 years ago, and it's used in the major operating rooms. It's a terrific way of using the laser to first melt the fat, and then you use a cannula to aspirate it. Personally, in the operating room, I use Vaser, which is ultrasonic, and then I use a power-assisted liposuction cannula, which is a hollow cannula that vibrates. Lots of other colleagues of mine will like the laser tip, the laser lipo. So the Lipo AI is a combination of that laser-assisted liposuction in the office, and you'd still need a cannula to aspirate it. But the nice thing is it's a 2 millimeter incision, so you don't even need stitches with that. Those areas that I target are arms, under the neck, the submental area, hips, chest, belly, thighs, calves. So if you're a candidate for that, I would be able to talk to you about that. The nice thing about that, again, we do some just oral sedation, like some pain medication and a Xanax, I also use Pronox, which is nitrous gas mixed with oxygen that the patient controls. Overall, we've had great success with it. It's very well tolerated. Patient comes in, has that treatment, and basically walks out the door. You have to have somebody drive you though, so you can't drive yourself in and drive yourself home. And then again, if you need more extensive liposuction, then I would go to the operating room, use the Vaser and the power assisted liposuction. And for some patients that have a little bit of skin laxity, then I also have the device in the operating room called Renuvion, which uses helium and plasma gas to coagulate the tissue, and it shrinks the tissue down so it can kind of pull in the tissue and some of the skin retract. It helps with the skin retraction.
And all of this you are determining during a consultation which would be the best device to reach the patient's goal.
Yeah, and that's why I think the face-to-face for me is so important. So it takes about a half an hour, 45 minutes to sit with me. I can listen to what you really want to treat, what your goals are, those areas that are problematic, and then the physical exam where I can really assess your skin tone, your tissue tone, and those areas that we might be able to treat. Which areas can we combine in one sitting? Which areas can we do all together? And then I think, go through those 3 different modalities. So the nice thing is we have something in the office that can treat you non-surgically. I have another device that we can treat you in the office surgically, and another device or another modality in the operating room that can treat unwanted fat and also some laxity in the tissue and the skin. So I thank you for joining today, and if you have any questions, please feel free to call. I've given you the number. But also you can follow us on social media and go to our website. So if there's any other questions or you're interested, I'm happy to meet with you.